Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. We've got a great segment coming up because we've got a very dear friend and probably one of the most prominent thought leaders on consumerism in the space, member of our League of Leaders, former winner of our J.J. Robbins Memorial Leadership Award, former Senior VP Healthcare Consumerism Cigna, and currently CEO of Consumerdriven, LLC. And Mr. John Young, good morning.
Good morning. Can you hear me okay, Doug?
Got it, John. Yeah, we got it.
Good.
How's it up in the frozen chosen this morning?
Well, guess. Just guess.
I had to throw that one out there a little bit. So. Hey,
I think that's why a lot of innovation comes out of Minnesota, because we're just, we can't go outside and play. So we just think.
Keep your pajamas on and do some thought leadership and do some brainstorming, right?
That's right.
Well, John, hey, great to have you on here as always, and great to talk to you. And today we want to kind of have you give us kind of an insight. You're out there across the space, touching base with the private exchanges. Certainly plugged into what's happening with HSAs, and so let's talk a little bit about exchanges. And what makes exchanges a part of healthcare consumerism?
Oh, it's just a natural next. It's kind of like consumerism 2.0. I mean, the first true consumerism plan. I mean, the one that gave people financial incentives within the plan design was back in October 1999, and it was Medtronic, and that was the first health reimbursement arrangement. And basically, the industry has kind of moved in a similar fashion for many years. Basically, the plans are designed. The employer kind of picks the design, picks the carrier, and then gives it to the employees and basically says, we want you to be more prudent consumers of healthcare services. So we're giving you some financial incentives within this plan design. And I think these exchanges take it to a natural next step, where it's adding an environment, particularly more effective with a defined contribution strategy, where the employer is giving a set amount of money that the employee can decide how to distribute amongst various plan options. It makes it more of a shopping experience, and people are selecting plans based on individual need. And then the chassis of that, I like that, the benefit administration on steroids idea is the chassis, and that's the chassis. Yeah. So it's an evolutionary part. You're just basically saying, we now not only do we want you to be prudent in healthcare services purchasing, but now we want you to kind of choose your own coverage, your own plan.
John,
maybe your own insurer,
Yeah, John. When you look at these exchanges, what are people selecting when they're in there?
Well, this is what excites me the most. Okay, so they're self-selecting to take more money home when they're given that defined contribution in that defined contribution scenario. They're buying higher cost share plans. They are self-selecting those, meaning they are taking HSAs. I've referred to this as kind of a Diet Coke Mentos moment. If you offer an HSA within an exchange, people are going to take it. I mean, the normal participation out there in plans are 10, 11%, depending on what survey you read. I've got some data I want to share with you from a few sources. The organization that put defined contribution healthcare on the map are the great people at Bloom Health, and 48% of Bloom members, this is brand new data for 2014 enrollment, okay? 48% of their members enrolled in an HSA-eligible plan. And what's important about this is that this isn't their first rodeo. So the people that have been in plans in this defined contribution scenario, over multiple years, 95% of those people that had an HSA in year one, they re-enrolled in the HSA. So that basically is saying, okay, we get it, we're working with it, we like this type of benefit. So that's Bloom data. Liaison says that 65% in their book buy an HDHP, with 80% of those opening an HSA. And then there's some interesting data out of Ann Hewitt, the choices both at Darden and Sears. Turned out it looks like that 42% of employees opted for a leaner plan. Of that, 39% selected a consumer-directed plan. Now, remember, in an exchange, as much as I love account-based programs and HSAs, I think it's important to note that in some environments, in most environments, some employees are going to select higher value plans.
Right.
In the A.M. Hewitt data, a quarter of those people selected richer plans because based on their family needs. There's a local company, Hubbard Broadcasting, that had all HSAs. That's all they offered. Mm-hmm. They were full replacement. And then they put in an exchange. And it still turns out that the majority of people, nearly 90%, take HSAs, but some select other types of plan designs. It is giving people more choice, which is consumerism.
Yeah, I agree with you, and I think it's a good point about the Bloom data. There's some in the industry that kind of push back on some of these stats and say, hey, the consumer is not making an intelligent purchase. But I think the Bloom data supports the fact that they actually are, because they're renewing in the HSA.
Yeah, I think it depends on how it's done too. Bloom has a decision support on the front end.
Yep.
That might be more educational than maybe some of the other exchange execution that's going on out there.
John, with all this adoption in the HSAs, with these numbers that you're putting out, what do you think are the important next steps in this whole evolution?
Well, I think this almost goes back to the evolution question. Let's look at the person today, right? Carnegie Mellon University puts out a survey last August that basically said 14% of us in America understand the terms deductible, coinsurance, co-payments, and out-of-pocket max. And I'm afraid those 14% are the people that work in the industry, that there's such low health literacy. It is, and there's such a behavioral economic issue that we have to overcome that I think the next steps are all about decision support. They're all about helping people understand. Oliver Wyman, they came up with a term that I just think is brilliant. They call it the rise of the sovereign consumer. The sovereign consumer, and that is the point of these exchanges and carriers that are on the shelves of these exchanges vying for that consumer to pick me. Yep. And today the consumer doesn't understand how the health system works, doesn't understand their health plan, doesn't understand the value of an HSA. They're disconnected. They're unengaged. No matter how much we try to say we've got resources and we're trying, we have got a pathetically uninvolved consumer. And I think these exchanges are going to change that. And I think especially it's going to force solutions to help them do that, to help them improve their financial responsibility, to help them understand the cost of health care. When exchanges talk about transparency, they're talking about the pricing of products within them. But we have to help people understand the prices of medical services, great companies like Castlight, HealthSpark, Change Healthcare, Healthcare Blue Book, the organizations that are out there that are putting real price and quality information in front of people. And then great companies like Wiser Health that are helping people make different care decisions based on clinical evidence and personal preferences. That's the stuff. That's the stuff that people need, because the next, that sovereign consumer is, they're going to be far more aware. They're going to be demanding, and they're going to be more needy. And in this cusp, the exchange, the big opportunity now is to fill that need, to take people right now who are completely kind of lost, despite our best efforts, to really help them get through the behavioral economics issues and to really embrace what they're deciding on to do.
Yeah, John.
So making there's so much. We could just spend the whole hour on this, but frankly, it's just making it clear, making it simple.
Yep.
What's in it for me? Helping people understand what's in it for me. Helping them navigate. Giving them call centers. Addressing those concerns about this change. Frankly, we have to really do this up front. When people are approached with this new approach, they look at all changes with a little bit of suspicion, And it must be good for the employer and not for me. There's a lot to be done in the midst of helping people embrace this. And a lot of great organizations are going to step up. But I think we cannot treat this just as a benefit administration on steroids. It has to be far more supportive. And frankly, I think health plans have the right. I think they could have a beef and say, look, we do this. We're doing this. I know at Cigna we did this really well. I'm sure Aetna and United, they do a very good job of providing people resources, tools to help navigate and that sort of thing. But if exchanges are going to try to get in that relationship with that consumer, they're going to have to provide that kind of level and even more.
Well, the health plan, I mean, they're partners. The exchanges, the health plan, the transparency players, it's all a common group. And I would go as far as say, the biggest change is coming with the employers themselves. The employers are becoming the consumer because they've got to take care of their employee population who are becoming the consumers. So there's just tremendous education and change going on, within the whole food chain.
Yeah, and we can't forget the employer. It turns out that health status is more related to job satisfaction than the results on your health risk assessment. That's from Gallup. I mean, their cultural, the career fulfillment that individuals have with their employer is absolutely fundamental core to improving health and keeping people in a higher well-being. It's much more holistic. So you're right. The employer has to still take on a big role with that kind of consideration.
John, there's a lot that we've just talked about, and we got about a minute and a half to go. So I want to give you a chance to really compress this into some clear takeaways for our audience. Take about a minute and give our audience some clear takeaways.
Okay. First of all, different projections out there for growth, but it's going to grow. EBRI says maybe 15 million by 2020. We've got like less than 1 million in these exchanges today. Accenture says 19 mil by 2016. Oliver Wyman says nearly 40 by 2018. Point is, this thing is going to grow. There's a recent survey done by the Private Exchange Evaluation Collaborative that basically said 45% of employers think they'll be in an exchange before 2018.
Right.
And there's so many differences out there, so many different flavors, carrier-owned, variable models that there's many carriers on the shelf. There's fully insured. There's self-insured. There's reasons why they choose these specific types of flavors. The Ann Hewitt models is all fully insured, which is that really helps the health plan have the incentive to keep costs down, as opposed to just a claims pass-through like in an ASO general environment. I mean, so that's what they're banking on. Variable models from other types of advisor control. There's so many different options. But I guess I would like to say this, if I have just a few more seconds, is that despite this awesome year-over-year growth that we've had in CDH plans, CDH plans are only covering about 20% of Americans with only, and like you said, about 8% take an HSA qualified plan. Mm-hmm. And that's exciting, but I think it's a fizzle because these are proven ways to get people healthier and to lower costs, and enrollment should be much higher. And exchanges and defined contribution are the way to get there. That's what's going to change the game. There's going to be much higher adoption. It's going to be a better chassis to drive enrollment to consumerism plans. So we have to fully support. There's those differences I think we all need to embrace. Not all types are going to appeal to others. But for this to work, health plans have to participate or choice goes away. And without choice, there's no need for these exchanges. So
hey, John, not to cut you off, but a lot to talk about, and I want to make sure our audience hears on this segment that they can come and hear you at, IHC Forum in Atlanta. John will head up our general session on defined contribution exchanges. He and Todd Berkeley will also do a lunch and learn after the pre-cons on HSAs and the exchanges. So I wanted to make sure our audience heard that. You can join John here in Atlanta in May. And John, thanks so much. A lot to talk about. We'll have to have you back on soon.
Okay.
Take care, my friend. To our audience, stay tuned for the next segment, Healthcare Consumerism Radio.
You're listening to America'sWebRadio.com, the pioneer and leader in chat radio. Thank you for listening.
This is Doug Field with CEO of the Institute for Healthcare Consumerism, and welcome back to Healthcare Consumerism Radio. In this segment, we're going to continue our discussion on this emerging, fast-growing private exchange marketplace. And joining with us today from Benefit Focus, one of the leaders in HR benefit, communications, administration, and education space, and now one of the leading providers of private exchange platforms, is Shan Fowler, Director of Product Management and Marketplaces. Good morning, Shan.
Good morning. Thanks for having me.
Yeah, how are you today?
I'm doing great. Great, thanks.
You coming to us from Charleston?
We are, yes, Charleston. A little bit cool out here, but probably still warm for most of the country, so
Yeah.
No complaints.
Same for us over here in Atlanta. We're, we can't complain too much when we're talking to people in Connecticut and Chicago. So. Well,
Exactly.
Shan, talk to us a little bit about our audience, a little bit about what Benefit Focus is doing and specifically doing in this, private exchange marketplace.
Sure. So Benefit Focus is a technology company. We're a software as a service cloud enrollment benefits provider, solutions provider. So what we do is we provide enrollment and billing and anything that really surrounds the enrollment experience or the enrollment benefits experience for both employers and for the the health insurance carrier and also other insurance forms. So our tagline is all your benefits one place, and what we do is we provide a very consumer-centric online enrollment shopping experience so that you can go through as an employee or as an individual and select your benefits all in one place, go through the process as much as possible all online, and then as an HR administrator for an employer, you can go through and manage your population and the enrollment needs on an ongoing basis.
Now, Shan, one of the things that's going to take place, the private exchanges is the wild, wild west right now, but open enrollment for this year is going to be the wild, wild west because everybody's going to have to do it underneath some new criteria. What are some of the essential things that employers should focus on during this year's open enrollment?
Well, I think that from the employer perspective in particular, one thing that is very critical is really that communication of all of the changes. So certainly you have so many different scenarios, whether you're a small employer or a large employer is going to change what message you're giving to your employees. So really what you want to do is make them smart consumers, because the bottom line is that with the changes that are happening, by and large it's going to require that employees or individuals are going to be taking on more of the time and the consideration for selecting their benefits. So whether that is going along with a high deductible health plan, whether it's understanding what changes they're seeing to their plans because of healthcare reform, the challenge is making sure that they understand that. So that the employer is not getting, from our perspective as Benefit Focus, so that the employer is not getting, hit with all of these questions, or, in turn, so that the health insurance carrier is able to, field the questions as they come. And I wanted to touch upon that area that I talked about with, like, the changes in plans. Certainly there are changes in terms of, essential health benefits and the actual plan designs that we're going to be seeing. But what we're seeing among a lot of carriers is that the notion of a renewal or sort of updating your current coverage just with a new rate is going to be something that particularly this year for this open enrollment is going to be a challenge, because there are so many changes that healthcare reform is requiring that health insurance carriers are essentially creating all new plans for them.
Right.
And they're trying to match them up as much as possible with existing coverage, but it may be, especially in that when you get down market into the smaller businesses, there will be a lot of changes, and so communicating those changes to employees, I think, is a great challenge.
Yeah, and surprisingly, I think to a lot of us in this business, health savings accounts married to high deductible plan have come out very, very well to sit in the exchanges. Agree?
Oh, absolutely, yeah. Another thing that we look at as far as that goes, and again, this is sort of a communication challenge, is how coinsurance relates into that, and because of how the new models for out-of-pocket maximum that we see at some carriers and so forth. So, yeah, absolutely. I mean, the high deductible health plans, if anything, they're going to become extremely, alluring to the average consumer. And really because, they may also have more options. For those who are going directly to a public exchange for their coverage, certainly they're going to be the lowest cost plans that you see out there. So I think you'll see a lot of consumers are going to sort of gravitate toward these plans.
Now, one of the things that, employers have a lot to think about right now, and one of the aspects that was created underneath the healthcare law was the pay or play. Do I pay or do I play in some type of option? Can you speak a little bit to that? What might be best for, say, an employer with 50 employees or an employer with 10 employees?
Yeah. So, and it is, that's sort of the sweet spot, if you want to call it that. That kind of that area where if you go from 49 full-time employees or 50 full-time employees to 51, then all of a sudden all of these different considerations go into effect, and primarily that pay or play. Like I am now, as an employer, required to provide my full-time employees coverage or I face a penalty. And I think that, part of this is that there is a strong financial decision to be made among these employers. But, the other part of it is that what we see is that depending on it's very dependent upon your industry as well. So if you are in an industry that has traditionally covered all of your employees anyway, there may not be as much of a decision to make between 45 and 55 employees. Whereas if you're in an industry like retail or the restaurant business or any of these things that have a largely hourly population and in a lot of cases a low income or a lower income population, then it's a really serious consideration because first off, you're looking at a penalty where before you may not have had or you didn't have any penalty, and secondly, you want to do the best by your employees. So, it may be that you're in a business where it actually makes more sense for you to pay the penalty and let your employees go out to a public exchange and see if they are eligible for subsidies, and that's your best bet in providing your employees the best level of coverage. On the other hand, it may have such a broad impact on your business that you have to make those tough decisions. And so I think you've seen that a lot in some of the recent press that's gone around. There was the whole Papa John's thing about, say, the pizzas were going to go up in cost, and Wendy's. There were some Wendy's and Applebee's franchisees who were saying, we're essentially not going to be able to provide coverage because of these new rules and the economic impact they're going to have on us.
Right. But I think you go upstream to a lot of the mid-sized and large employers. The consensus is they want to retain the ability to provide, health care and benefit coverage to their employees for a lot of sound reasons, one of that being, retention of a skilled workforce.
Oh, yeah, absolutely. And I think that you see time and again, we've read studies from Aon Hewitt and Mercer and Towers Watson and you name it. They all essentially say exactly what you just said. Not only do we think that we're still going to provide benefits, but we almost see it as more important now because it's a real differentiator in the market.
For what you're doing with Marketplace, coming back to, some clear differentiations, it seems to have been, with your footprint in this space as one of the leaders in communications, enrollment, and administration, the Marketplace was just a natural extension for you, correct?
Oh yeah, absolutely. We've kind of joked that back as long as I've been here since 2007, we've had this notion of marketplaces in mind because of healthcare consumerism. And we saw just a couple of months ago, Kathleen Sebelius started calling the public exchanges public marketplaces.
Right.
And they even have that when you go to healthcare.gov now. So we like to think they were taking our lead, but it's it really has been that the notion of a marketplace and the focus on consumerism is something that's really been a key factor of development for us. We've always kept it in mind.
So would you think that all healthcare reform, do you think that helps or hurts, the concept of healthcare consumerism?
Well, I think that you got to take a look at it in two levels. You have this, this chaos that's going to happen this year, and I think that you're going to see, rates that may sort of go counter to the idea or some of the ideas of the quote unquote Affordable Care Act. But I think that once things settle down, the evolution is toward healthcare consumerism. When we talk about it internally, we always remind ourselves that healthcare reform didn't come about, because policymakers wanted to sort of stick their nose into the space. It came about because there was a real need for consumerism, and there was a real need to address costs and what that impact has on individuals. So we like to keep that in mind. Certainly, if anything, healthcare reform has really accelerated some of the things that I think we've all been talking about for years. And I think there's going to be a real kind of disruption this coming year, but once things settle down and you start to see some real trends, I think that healthcare consumerism is just going to be more important than ever.
Now we sing the same song. Obviously, the genesis of the Institute for Healthcare Consumerism that has now grown to over 70,000 employers and health plans, advisors, and brokers was that healthcare consumerism is a legitimate megatrend, and
yeah, absolutely.
Economic impact, policy impact may deter it or slow it down a little bit, but it's here, and we're probably in about the 9th or 10th year of that megatrend, and it takes about 11 or 12 years to really fully mature. So we actually agree with you.
Yeah, I agree.
Hey, Shan, time flies when we're having fun. This has been really informative. So we got about a minute and a half to go, and I want to give you the chance to really kind of close out this segment give our audience some clear takeaways about what Benefit Focus is doing in this space.
Sure. So, I think that our focus is, on providing the whole benefits solution for our customers, whether they're employers or health insurance carriers. And we're unique in the space that we do have that dual focus on both the payers and the employers providing the coverage to their employees. And what that has led us to is that we have always focused on the end user, on the consumer, because ultimately that's what is that's who the other constituencies are looking to make sure that they're happy and that they are getting their needs addressed. So I think that's has been a key driver for us and a key advantage of us, and so we're very much in lockstep with the work that you're doing, and we think that it's if you go from the bottom up, you really solve the problem much greater.
Well, listen, we appreciate you being with us today and enjoyed this segment. And you have a great weekend over there in Charleston. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.